Hello, everyone, and welcome to Working In with Heights, potentially the only series dedicated to exercising your brain. So, excellent, just checking that we're live, which we are, good. Okay, so give your muscles a break for an hour and get ready to stretch your synapses instead. Now, at Heights, we believe a healthy brain is the key to a healthy and happy life. So we created this idea of a cranium gymnasium to help people take the time to nourish their brains as well as their bodies. So each week, as you know by now, we have a different mental fitness instructor, all with different specialities to keep things fresh and exciting. The aim over the next hour is to deliver as much actionable, useful information as possible. So even if you only learn one thing, you can put it into practice straight away and start seeing results. Now, Heights, as you might have guessed, is all about brain health and mental well-being. We make smart, sustainable supplements that combine the essential oils and nutrients your brain and body need, and we deliver them to your doorstep every month. But we also create clever content in collaboration with leading experts to help you optimize your brain's health and performance so you can reach your heights, whatever they might be. So that's enough about us. It's time to get started. Now, just a bit of housekeeping. We've got a moderator in the chat, our wonderful community manager, Emma. So if you've got any questions, please post them in there for Dr. Arman and she'll send them over to us and we'll ask them in the Q&A in between. Also, something we've been terrible at doing ourselves is encouraging you to subscribe to our channel. We're newbies to YouTube, but thanks to COVID, we launched our channel just over a month ago and have racked up over 20,000 views already, which is great. So if learning about your brain from the world's leading experts sounds good to you, then hit subscribe right now and we will continue to deliver you regular neurological nourishment. We've got the brilliant Natalia Talkowska, who's going to be doing a live illustration of our session as well to share on social of all the things we cover. So Daniel, you're going to have your very own story map by the end of this session to share your wisdom in illustrative form. Now, that's enough of the introduction. It's time to introduce today's guest, Dr. Daniel Arman. We're going to cover 3 topics today: how to end mental illness, overcoming anxiety, trauma, and grief, and is it ADD or just modern society? So first, Dr. Arman, can you please give us a short introduction to yourself, what you do, and of course, some mention about your brilliant Arman clinics?
Well, thank you. We have 8, soon to be 9 Amen clinics around the United States, West Coast, East Coast, middle of the country. We have seen patients from about 155 countries, and over the last 30 years built the world's largest database of brain scans related to behavior. I've written 40 books, 12 New York Times bestsellers, and I'm just eternally passionate about brain health and brain fitness. I have a new book called The End of Mental Illness, because what we've learned is these are not mental illnesses, they're brain health issues. That one idea just changes everything. So I'm a double board certified psychiatrist. I'm board certified in child and adolescent psychiatry, but also in general psychiatry. And I'm just excited every day about helping people have better brains and better lives.
Do you feel like when people start engaging with you, they're second guessing if they're saying the right thing in front of you?
Well, I don't know. We'll find out.
With those kind of credentials. Yeah, exactly. Let's find out. Okay, well, let's start with your first work in. So how to end mental illness. Now, I guess first things first, it's really hard to treat what we can't diagnose. So if you can just give us a clearer understanding of what comes into the categories of mental illness, we'll start from the top there.
Well, people typically put anxiety, depression, ADD, bipolar disorder, schizophrenia, obsessive compulsive disorder, post-traumatic stress disorder, personality disorders, and it completely ignores the fact that these are brain health issues. But what I learned a long time ago when I became a psychiatrist is nobody really wants to see a psychiatrist. No one wants to be labeled as defective or abnormal, especially not with your mind, but everybody wants a better brain. So when I started looking at the brain, I'm like, oh, they're not mental. And just the word mental is stigmatizing. You're mental. I'm not sure in the UK it has the same meaning here in the United States, but it's not a good meaning. And but your brain has a completely different meaning, which is positive. So one is negative and one is positive. And I want to be a brain because ultimately my brain controls everything I do.
Yeah, and we say exactly the same thing with heights. We're in, the idea of mental well-being and preventative health. And when you even mention the words mental health, even though everyone has mental health, people just assume it's a mental health problem. And that's not what you've said. You've just said mental health. It's impossible not to have mental health. However, it's just been stigmatized by press. And so I think it's so interesting and important to find that distinction. And also, I suppose, with the brain health distinction as well, really, we're talking about the organ.
We're talking about the organ. I'm in a new docu-series on YouTube with Justin Bieber. I've been his doctor for a long time. And, he's a superstar, but he sort of had a superstar attitude where he'd do what I said and then he wouldn't. And then about 18 months ago, he walked into my office and he said, my brain is an organ, just like my heart is an organ. If you told me I had heart problems, I'd do everything you said. He said, I'm going to start doing what you say because I have to take care of the physical functioning of my brain.
And it's amazing how long that message takes to land with people, because it's just, out of sight, out of mind. So don't really think about your brain, can't see it. And so not very often do people consciously think about it.
Well, that's what the brain imaging work I do changed everything for me. So when I started it in 1991, I was already a double board certified psychiatrist, but I didn't care about my own brain at all. I mean, you can see the wrinkles in your skin or the fat around your belly, and you can do something when you're unhappy. But because most people never look at their brain, we just don't care about it like we should. And when I saw mine, and it wasn't nearly as healthy as I wanted it to be, because I played football in high school and I had meningitis when I was a young soldier in the military, I developed a concept called brain envy. I wanted a better brain. Freud was wrong. Penis envy is just not the cause of anybody's problem. He was about 2.5 feet too low in the body. It's brain envy. You got to care about these 3 pounds between your ears. It just makes a radical difference in everything in your life.
What mental illnesses have you seen at their worst and then had sort of a miraculous turnaround? Do you have any stories to share from, patients, obviously confidentially, but, the kind of things you've seen that can give some insight into, I guess, this concept of ending mental illness?
Well, my hero story is I started imaging in 1991, got no end of grief from my colleagues because it's not what psychiatrists are supposed to do. And that confused me because, most psychiatrists even now go, imaging is the future, imaging and genetics. And so I was doing it, and in a responsible way, in a legal way, in an ethical way, and so excited about it. But then I got all this pushback, which made me anxious and upset. And then in 1995, I got a call from my sister-in-law, Sherry, who told me that my 9-year-old nephew, Andrew, who's also my godson, attacked a little girl on the baseball field that day for no particular reason, out of the blue. And I'm like, wow, what else is going on with him? And she said, Danny, he's different. He's mean. He doesn't smile anymore. I went into his room today and found 2 pictures he had drawn. One of them, he was hanging from a tree in a suicide attempt. The second picture, he was shooting other children with a gun. And in retrospect, Andrew was Columbine or Sandy Hook or Parkland, Florida, waiting to happen. But by 1995, I already scanned about 1,000 people. And I knew that violence often correlated with problems in the left temporal lobe. And so they brought him 8 hours away to come see me at one of our clinics. And when we scanned him, he had a cyst the size of a golf ball occupying the space of his left temporal lobe. And when I got a neurosurgeon to drain the cyst, his behavior completely went back to normal. And it was really at that moment I lost my anxiety about what you thought of me. Because quite frankly, I just didn't care anymore. Because if you don't look, you don't know. But wholesale around the world, psychiatrists are making diagnoses based on symptom clusters with no biological data, and then prescribing medications that change your brain without any biological data. It's just insane. And so since that time, 25 years ago, I've really been a warrior for brain imaging, brain health, and behavior is just much more complicated than most people think. It's easy to call people bad. It's harder to ask why.
What are the main causes of mental illnesses that you've diagnosed and seen over the years?
Well, I think some of the big surprises from imaging is if you go, hey, Daniel, single most important thing you've learned from 160,000 scans. Mild traumatic brain injury ruins people's lives and nobody knows about it. Brain is soft, about the consistency of soft butter. Your skull is really hard and has sharp bony ridges. Your brain runs everything. How you think, how you feel, how you act, how you get along with other people. Damage the brain, you damage someone's life. Undiagnosed brain injuries are a major cause of suicide, depression, panic disorder, incarceration, and homelessness. There's a study from Toronto that says 58% of the homeless men, 42% of the homeless women had a significant brain injury before they were homeless. But yet in the homeless discussion and the problem of homelessness, we're not talking at all. I mean, they talk about housing and they talk about nutrition, and they're not talking at all about brain function, that if your brain's not working right, it's really hard, especially in a place like London or Newport Beach, where I live, to have affordable housing. I mean, you need to make good decisions. And when the decision maker in your body, your brain, is hurt, your decisions aren't as good, which means your money's not as good, your health is not as good, your relationships are not as good.
So I mean, just to summarize, I suppose, because I was going to ask, what are the main cures? But it sounds to me like, in a sense, information is power in this reality, right? As in the ability to know if you have a trauma or not is so important.
Well, know better, do better. I mean, the prescription is we should start looking at the brain just like we look at hearts. I mean, we screen virtually every other organ in the body except the most important one, your brain. And then brain health is really three things. It's brain envy, you got to care about it. Avoid anything that hurts it. You just got to know the list. The American Cancer Society just came out with, in fact, I did a blog on it yesterday that exploded. The title of the blog was, I Told You So. Alcohol is not a health food. Alcohol is, they actually recommended people don't drink because it's a major risk factor for cancer. Well, it's also a major risk factor for Alzheimer's disease, and it's a major risk factor for divorce and bankruptcy and domestic violence and having a car accident. So the idea that you should have, 1 or 2 glasses of red wine a day is just dumb. And I learned that from our imaging work. I mean, I have no dog in the fight, except I hate things that make your brain look older than you are.
And I suppose, there's a lot of, to use the psychedelics words, set and setting. It's a lot easier when you live in California, and the culture there is less around drinking, a lot more complicated when you're in busy cities like New York or London or Paris, where it's just so baked into the culture. So in that sense, I think it's really important to have more cheerleaders like yourself, championing the cause to make people aware that it's really genuinely bad for you, even in potential moderation. What are you, in your experience, what have been some of the most troubling misdiagnoses? Have you seen many of those?
So many. And I wrote a blog recently on bipolar disorder is the new fad. So ADD has been a fad for a long time, and we'll talk about that. But so many people get the diagnosis of bipolar disorder when in fact they have the results of a past brain injury. And so they have mood instability, irritability, temper problems, when that's not, bipolar disorder isn't the issue. It's we need to repair their brain. Because when you get a diagnosis like bipolar disorder, it implies a lifelong course of medication. And, I just have heartburn with that. You've made that diagnosis with no biological data. And that, it just doesn't make any sense to me. Schizophrenia, if you take a map of the United States and you look at the highest incidence of schizophrenia, it's the Northeast, the North Midwest, and the West Coast. But then if you overlay a map of the highest incidence of Lyme disease, an infectious disease from deer ticks, they're almost identical. Now, it doesn't mean everybody who has schizophrenia has Lyme disease, but if you're in one of those areas, you should probably be tested for it. And with COVID-19, in the end of mental illness, I talk about if you want to keep your brain healthy or rescue it if it's headed to the dark place, you have to prevent or treat the 11 major risk factors that steal your mind. And I have a mnemonic called Bright Minds. Well, the second I in Bright Minds is immunity and infections. And infectious disease is actually a major cause of, quote, mental illness. But if your brain's assaulted by a virus or a bacteria or a parasite, odds are you're going to have what looks like a mental illness, but it's not mental. It's an invasion of the brain. And we know now COVID-19 can get into your brain and wreak havoc in your brain health.
I mean, it's the perfect time to ask, but how do we end mental illness? And please do treat us to your mnemonic.
Well, we end mental illness by creating a revolution in brain health, where we love our brains, we avoid things that hurt them, and we do things that help them. And Bright Minds is basically, B is for blood flow. Low blood flow is the #1 brain imaging predictor of Alzheimer's disease, but it's also associated with ADHD, depression, and schizophrenia. R is retirement and aging. When you stop learning, your brain starts dying. I is inflammation, a major cause of anxiety and depression and pain. G is genetics. This stuff runs in families, but genes aren't a death sentence. What they should be is a wake-up call to get healthy. H is head trauma, as we discussed. T is toxins, so yes, alcohol, but also things like mold and carbon monoxide, and general anesthesia, and all sorts of things that can damage the brain. M is mind storms, abnormal electrical activity in the temporal lobes. I, second I, is immunity infections. N is neurohormone disorders. D is diabetes. It's a worldwide epidemic of being diabetic and overweight. I published 3 studies. As your weight goes up, the function of your brain goes down, which should scare the fat off anyone. And S is sleep. Sleep-related disorders are so common, a cause of brain health issues.
And where does, in your opinion, nutrients and nutrition factor into this?
Well, in so many of them, that if you want to increase blood flow, beets, cayenne pepper, rosemary, oregano help. If you want to decrease aging, you have to make sure your iron is not too high. This is where red meat becomes an issue. Inflammation is processed foods and sugar and foods that quickly turn to sugar. Toxins, fast food is just loaded with toxins and obviously diabetes. And did you know that belly fat? So I'm like, I don't know if this is true in London, but it's truly here in the US that we have so many pregnant men in this country. It's like, with the big pot bellies, it's like, dude, deliver the baby, because belly fat increases 5 of the 11 risk factors. Belly fat decreases blood flow to the brain. It increases inflammation. It takes healthy testosterone and flips it into unhealthy cancer-promoting forms of estrogen, and fat stores toxins. So, just being overweight is more likely to give you mental health challenges because it's damaging your physiology.
So just to summarize, what would you say are your top 3 tips for ending mental illness if you had to pick 3?
Well, the first one is this little tiny habit I love. When you go to make a decision in your day, just ask yourself, is this good for my brain or bad for it? And if you can answer it with information and love of yourself, love of your mission, love of your family, you'll start making better decisions. Before you go to bed at night, what I do is I say a prayer and then I go, what went well today? And by doing that, where you bring your attention always determines how you feel. I actually set my dreams up to be more positive. And then I think all of us should be taking simple supplements like vitamin. Have an epidemic of low vitamin D. There's some evidence that COVID-19 is more virulent for you if your vitamin D levels are low. And omega-3 fatty acids. There are just lots of correlative studies on low omega-3 levels and high levels of depression.
Okay, thank you. We're going to go to questions from the audience. We've got loads coming in, so I'm going to have to be picky. We'll start with a question from Tiffany, who says, I'd really like to know if Dr. Arman has any advice on migraine research and mental health living with pain.
So if I have migraines, then what I do for my patients, the first thing I make sure is they don't have something called Irlen syndrome, IRLEN, which is a visual processing issue where their brain is sensitive to certain colors of the light spectrum. And wearing colored filtered lenses can make just a huge positive difference. So if you just go to Irlen, IRLEN.com, there's some self-tests you can see if maybe that's an issue for you. The second thing I do is put everybody on an elimination diet. We eliminate chocolate and wine and dairy and gluten, corn, soy, artificial dyes, and sweeteners, just to see if your brain's not sensitive to one of those things. And then the third thing, I have everybody take 400 milligrams of vitamin B2. And it has been found in a significant number of cases to help with migraines.
Brilliant. Thank you. Okay, we've got a question from Kate who says, a relative was diagnosed with schizophrenia about 24 years ago. Can this be fixed many years later if it is discovered that Lyme's disease, etc., is the cause?
Yes. I actually have a patient, when she was 16, she went to Yosemite, one of our national parks, and was surrounded by 6 deer, and they thought it was a magical moment. But 10 days later, she started hallucinating, became aggressive and delusional. Diagnosed with schizophrenia. She didn't. She had Lyme disease, which we discovered. And on an antibiotic, she got her life back. Well, her uncle had actually been in one of the state hospitals for schizophrenia for 25 years. And when we tested him, he had a cousin to Lyme disease. And when it was treated, he got his brain back. Now, in the process, and what I discovered I published a study. It's the world's largest imaging study on 62,454 scans. And we looked at how the brain ages from 9 months to 105. And then we looked at what accelerated aging. And schizophrenia was the worst. It accelerated aging. And people with schizophrenia die 10 years before other people. Their brains as a whole are very unhealthy. And when we can get them to fall in love with their brains, to eat right, to exercise, to take simple supplements, in addition to their medication, they do so much better. But nobody's talking to them about your diet will matter. There's actually one study that was actually done in the 1970s where on a psychiatric ward with schizophrenic patients, they didn't let them have gluten or dairy. Significantly less psychotic symptoms when they just eliminated gluten and dairy. Now, it doesn't fix everybody, but even if it helped 4% of people, wouldn't you at least want to try it with everyone to see if you were one of those people that was sensitive?
Okay, I've got, with you mentioning drugs, could you ask what happens to the brain after coming off an SSRI?
So it's one of the reasons I really don't like starting them. I mean, I will if I need to, but getting off of them, like benzodiazepines, are really hard. That many people feel like they got the flu and they might get nauseous, have GI problems. And so what I generally do for my patients, where I want to take them off or they want off, is we'll do it over a couple of months. That will actually do it very slowly. And that way their brain can recalibrate itself.
Great. Okay, we got a question from Joel who says, as someone with a healthy brain, what supplements do you take on a daily basis then? How do you look after yourself?
Well, my brain's so much healthier than it was 30 years ago. I take a multiple vitamin. I just think of it like insurance. I take omega-3 fatty acids. I take curcumin because it decreases inflammation. And I am a huge fan of saffron. There are 21 randomized placebo-controlled trials show like head-to-head against Prozac and Zoloft and really good antidepressants, equally effective. But the SSRIs sort of steal your sexuality. They decrease your interest. They increase having orgasmic problems. Saffron's actually pro-sexual. And so we actually make something called Happy Saffron, released it right at the beginning of the pandemic. And I'm like, and I'm not depressed, but I think I'm like, I'm going to take this just to support my mood during this time. And I like it a lot.
And you seem very jovial. Okay, thank you, Dr. Arman. Now, there's definitely going to be time for more of the questions that have been coming in after this second work-in, so we're going to crack straight on. This one is on overcoming anxiety, trauma, and grief. So firstly, is there a difference between how to diagnose and treat these if they've been caused by external forces rather than internal forces?
Well, ultimately, whatever happens to us externally is impacting what's going on internally. So it's a little bit of a false dichotomy. And, you know, the people that have done really well during the pandemic brought a better brain into the pandemic. There's a concept I like called brain reserve, which is the extra tissue we have to deal with whatever stress comes our way. And going into a pandemic, if you have a healthy brain, you're more likely to be able to withstand more stress. And so I have a patient who happy all of her life, but then had general anesthesia in January, and then subsequently lost 5 of her friends in the pandemic, and one of them to suicide. And then she got very depressed. And my hypothesis was if she wouldn't have had the general anesthesia twice in January, she may not have been depressed. So you see that stresses actually stack, and the more physical and emotional stresses you have, the more likely you are to break. And getting well, actually, we have to address each of these risk factors.
How does one overcome anxiety?
When the pandemic actually happened for me, I wrote down mental hygiene is just as important as washing your hands. That we need to disinfect our thoughts, kill the ants, the automatic negative thoughts that steal your happiness. And it's a practice. So it just doesn't happen. It's something you have to work out. Just like if I wanted to lose 30 pounds, I couldn't have a salad today at lunch and expect, well, that's going to fix the problem over time. Is I need to develop habits that I put into my life over time. And so if you're anxious, let me give you just a couple of things to put in your life on a day in, day out basis. Meditation and diaphragmatic breathing exercises. So important. Almost all great meditative practices start with diaphragmatic breathing. And so here's the pattern I want you to do 2 to 3 times for 2 minutes each. So it's not a lot of time. I want you to take a deep breath, as deep as you can, 3 seconds in, and then hold it for a second. And then I want you to take 6 seconds to breathe it out. So twice as long to breathe out as you breathe in triggers a parasympathetic or relaxation response. Then hold it for a second out and repeat that 10 times. 3 seconds in, hold it, 6 seconds out, hold it, repeat 10 times. So powerful. It's just like you took a Valium or an anti-anxiety drug, but it's got no side effects. If you do that on a regular basis, you're going to begin to lower that fight or flight response that your body is feeling, that so many people are feeling with the pandemic and the subsequent societal disruption and the rioting and all the craziness we see on the news. The second thing is turn off the news, because the news drives anxiety, and they do it consciously and they do it purposefully. They do it because they know whatever bleeds leads. Whatever bleeds, whatever's terrible, drives clicks. And the news is not about the news. I mean, we should stop lying to ourselves. The news is about advertising revenue. And in the end of mental illness, I have this whole section on if I was an evil ruler and I wanted to create mental illness, what would I do? And I'd create the American, it's probably the same thing true in the UK, I'd create news that's out of control, but leading with what's awful rather than what's awesome. And both of them are news. One drives mental illness, the other one drives mental health. Whenever you feel sad, mad, nervous, or out of control, write down what you're thinking. And then ask yourself if it's true. Every time you have a thought, your brain releases chemicals. Every single time you have a thought, your brain releases chemicals. Negative thoughts, angry thoughts, hopeless thoughts, helpless thoughts, worthless thoughts, should and shaming thoughts, all release chemicals that make you feel bad. And it happens immediately, but the opposite is also true. Whenever you have a happy thought, a hopeful thought, a loving thought, your brain releases a completely different set of chemicals. Thoughts are automatic, they just happen, and they lie. Just because you have a thought has nothing to do with whether or not it's true. And I'm not a fan of positive thinking. I'm a fan of accurate thinking. And so if I get the thought in my head, my wife never listens to me, that's a really negative thought. And it'll make me feel sad and more isolated and actually give me permission to be rude to her, which means she really won't listen to me. So whenever I get a bad thought, I just write it down. And I'm like, well, is that true? Can I absolutely know if that's true? So learning to manage your mind. I don't know if you were good when you were a teenager at talking back to your parents. I was excellent, but nobody ever taught me to talk back to myself. And it's just a skill we should be teaching second graders. Actually, I have a children's book called Captain Snout and the Superpower Questions, teaching kids to kill the ants. So breathing, not believing every stupid thing you think, turning off the news, focusing on gratitude and appreciation, because where you bring your attention determines how you feel. Music. So there are all sorts of pieces of music that are relaxing, right? Music changes your brain in a good way or a bad way. And hypnosis. I'm actually a huge fan of meditation, but also hypnosis and guided imagery, just to retrain your brain to be in a healthier state.
So talking about retraining your brain to be in a healthy state is, I guess my next question leading on to this is how we overcome trauma. So does that play a part?
Absolutely. You always want to get the past to stop infecting the present. You know, you want to be reacting out of what's going on now rather than when you were 4 years old and your dad was an alcoholic. And so I'm a big fan of a psychotherapy called EMDR. It's a specific kind of treatment called eye movement desensitization and reprocessing. They have you bring up the trauma, and I'm not a fan of ignoring what you're feeling. I mean, I really want you to feel what you're feeling, and then see what it's connected to in the past that might be driving your overreaction in the present. And EMDR, so people can, look it up online and learn about it. And also, whenever you react in ways that seem not to make sense, I have a bridging technique where I want you to really, what are you thinking and feeling? And then, when's the first time you thought that? Just to begin to break up these bridges from the past that are driving the present.
So do you think some of these mental health issues that we talk about, anxiety, trauma, grief, do you think any of them are good for us in any way?
Well, some anxiety is critical. People who have low levels of anxiety die the earliest. This fascinating study out of Stanford where they looked at 1,548 10-year-old children in 1921. And then they followed them for the next 90 years, looking at what goes with success, health, and longevity. And one of the major findings was the don't worry, be happy people. I used to always want to be one of them. Until I read this study, they die the earliest from accidents and preventable illnesses. So, the COVID-19 don't worry, be happy people were the young college students on the Miami beach, right as the beginning of the pandemic. They're there for spring break and they're like, bring it on. And that is just dumb, right? I mean, you want to have a healthy dose of anxiety because the coronavirus is wicked. It can hurt people. And it has. It's, killed hundreds of thousands of people around the world. So we want to have healthy anxiety because that gives us forethought to plan for potential danger down the road. I'm not a fan of trauma and I'm not a fan of depression. But with trauma comes post-traumatic stress disorder, but it also comes post-traumatic growth for many people. So it's sort of a bell-shaped curve. People are in a fire. About 80% of them are going to be okay. 10% of them will develop lasting PTSD, nightmares, flashbacks, anxiety, feel like their future is shortened. But about 10% of them are going to develop what we call post-traumatic growth, where they're actually going to begin to see new possibilities. Their relationships will be better. They'll have spiritual changes in a positive way. And, I mean, I've been traumatized by the fight I've had with my colleagues, but I'd clearly do it again, right? It's just made me a better human being.
Well, you've had post-traumatic growth.
Yeah, because I just don't care what, other people think of me. And I feel like I can engage in what has really become the fight of my life. And it's made me a better leader. It's made me stronger.
So in summary, what are your top 3 tips in overcoming anxiety, trauma, and grief, please?
Well, we didn't talk much about grief, but grief is fix sleep first. That's so important. And with grief, people have to begin to deal with the death dragon, which is just, stomping around the globe now with COVID-19. And you really have to come to grips with death because we're all dying. And I think it's the denial of death that drives a lot of anxiety for people. So actually making peace with death is important. But practically for grief, fix your sleep first. That's really important. For anxiety, write down your automatic negative thoughts and learn how to correct them, and then engage in diaphragmatic breathing. Help you so much.
Great, thank you. Okay, so again, questions coming in thick and fast. We'll get straight to them if we can. So question from Catherine: besides coming to one of Dr. Arman's clinics, what would you suggest to support someone recovering from a MTBI even over a year later?
I have a book called Memory Rescue, and there's a whole chapter on how to deal with, and I hate MTBI because it stands for minor traumatic brain injuries. When you actually look at them on spec, they're not minor. They, can disrupt the brain. The doctors call them minor because you may not have lost consciousness for 4 days, but brain is soft, skull is hard, brain can really be hurt. And so dealing with concussions, Memory Rescue would just be a great book. One of my doctors, Kabran Chapik, actually wrote a book called Concussion Rescue. And that's when brain health really becomes essential, putting the brain in a healing environment.
Great. Okay, a question from Denise. How can we save our brain from a deep depression? How can we manage our brain? And how can we stop the thoughts we don't want to think on?
Well, so you don't medicate the thoughts like with alcohol, marijuana, antidepressants. You write them down. You challenge them. Whenever we block them, they come out in different ways, whether it's neck aches or belly aches or headaches or irritability, panic attacks. I think we need to face them head on, write them down, and then in the end of mental illness and many of my other books, I have a process you can take them through to really get them out of your head. But you have to get them out by the root. If you just mask them, they'll bite you in other ways.
Okay. Question from one day, which is, any plans for Arman clinics in the UK, please?
Well, we've had many people approach us about having an Arman clinics there, but no plans at the moment.
Not yet. Okay. All right. We'll do last question on this because then we can crack on. RE trauma and developmental trauma. Question from Amy. What's the best way to help with this?
Ask me that again. The question's about developmental trauma.
Yeah. So RE trauma and developmental trauma. What are the best ways to help with this?
Well, one, and people don't ever do this, you have to get your brain right, because I actually published a big study on post-traumatic stress disorder. Your emotional brain becomes stirred up and works too hard. So when your brain is healthier, your brain can actually settle itself down. But then a treatment that we talked about, EMDR, is very effective to deal with developmental trauma and get the past out of infecting the present.
Great. Thank you. Okay, on to our last work in, which is it ADD or just modern society? And this one really resonated with me because I suffer so many of the symptoms of ADD, though never diagnosed. And I actually say to people, it's mostly modern society. I just need to learn to focus better, but who knows? So I guess let's start there. Given the amount of kids in America on amphetamines as diagnosed with ADD, do you believe it's worse in America than anywhere else in the world?
That's an interesting question. When they've actually studied ADD in China, in the UK, in India, using the same criteria, it's sort of about the same. It's anywhere from 5 to 10% of the population. And so it's not uniquely American, but American psychiatry, as much as I don't like it, is more developed, more organized than in most parts of the world. So ADD is real. And when it is left untreated, it has a real negative impact on people's lives. Left untreated, half of the people with it will have a substance use problem. About a third won't finish high school. There's a higher incidence of divorce, incarceration, bankruptcy, job changes, moves in people who have ADD. And I've been studying it for 40 years. And every year somebody says it's a fad, but it's not going away. And our society is making it worse. Our diets make it worse. The gadgets we use make it worse. Needing to have immediate stimulation, video games, pornography, all of that makes ADD worse. And so the question is, how do you know, is it ADD or is it modern society? ADD is really, I think, these 5 symptoms where you have them pretty much all the time. Short attention span, but not for everything. Short attention span for regular, routine, everyday things, schoolwork, homework, paperwork, chores, the things that make life work. But for things that are new, novel, highly interesting, stimulating, or frightening, because they have their own intrinsic dopamine or their own intrinsic stimulation, people can pay attention just fine who have ADD. And that's what confuses people. You just fall in love, and new love is a drug. And it's like, oh, you just love her red hair, and all you can do is think about her. Well, you're very attentive for about 3 months. But then as new love turns into more regular love or lasting love, the dopamine's not quite there as much, and you can't pay attention at all. And she's like, what the heck happened? So short attention span, not for everything. Easily distracted, disorganized, so time, space, procrastination. You actually don't get things done until the last minute. You don't get things done until someone's mad at you to get them done. And then issues with impulse control. And if you have those 5 over, that's been the story of your life, you probably have ADD of one form or another. I wrote a book on ADD called Healing ADD, where I talk about 7 different types of ADD. But if you're periodically distracted because too many things are coming at you, text, email, your phone, that's not ADD, that's modern society. If teachers said you were chatty, that you were restless, that you were impulsive, that you couldn't keep your hands to yourself, and it wasn't just the 3rd grade teacher, it was kindergarten, 1st grade, 2nd grade, 3rd grade. A half an hour of homework took you 3 hours to do with your mother screaming at you to get it done. That's ADD.
Okay, so is there a cure?
Well, absolutely. Actually, when I wrote Healing ADD, my editor wanted me to call the book The ADD Cure. And I resisted it because for most people, cure means, well, you can end it. Healing was just more active, and I think a better title. You can manage ADD so that it doesn't interfere with your life. And treatment, in my mind, does not start with medication, although if I need medication, I'll use it. It starts with diet and exercise. And then support from a nutrient standpoint, zinc, magnesium, iron, make sure it's at a healthy level. Too high is bad, but too low makes you look like you have ADD. And so from a nutrient standpoint, diet and exercise, there's this great study from Holland where they took hundreds of ADD kids and they basically put them on an elimination diet. They could eat vegetables, fruit, lamb, turkey, rice, and pear juice. That was it. But at the end of 3 months, 70% of the kids no longer had ADD. And so I think our modern diets are significantly increasing the incidence of ADD.
It's interesting. I've got a couple of friends who have severe ADD and they call it a creative superpower. So what do you think about it from that perspective? Because left unchecked, I guess after they got diagnosed, they were pretty sure that that was a trigger for their success.
Yeah, no, I treat many very successful ADD people. And when they actually get treated for it, they become more creative because they finish things. But you know, when you have ADD, often you have 30 thoughts in your head at once. And so I have a well-known writer. She takes her medication when she's dealing with her children. She takes the medication when she's managing her home, but she doesn't take it when she writes because she likes all the thoughts in her head until she gets to the deadline. And it's like, oh, I have to turn this in. And then she might take the medication.
So what do you think is going on in modern society that's causing the extra concerns that really aren't helping us?
Our diet is terrible. We're not outside like we used to be. Children are on their devices playing video games, which has just stolen their attention. I'm horrified. I've never seen the level of 9, 10, 11, 12-year-old boys addicted to pornography. The parents aren't paying attention to the gadgets they're giving them, and they're being exposed to something that will wear out the dopamine centers in the brain. So you have these two areas in your brain that respond to dopamine. They're called the nucleus accumbens, and they give us happiness. They give us pleasure, drive, motivation. And if you wear them out, you end up with terrible ADD and depression because you feel flat. So cocaine will do it. Fame will do it. And, you know, Miley Cyrus, one of my patients, we did an Instagram live together and talked about how fame really wore out the pleasure centers in her brain. Video games will do it. High fat sugar foods, donuts will do it. And the more you wear those out, the harder you just look like you have ADD and depression, which puts you at great risk for addiction.
So is it really ADD or is it modern society, Dr. Rahman? What do you think?
You know, for me, I look at someone's pattern over a long period of time. And how were you in school? And then I look at your people, right? So tell me about your mom and her family, and tell me about your dad and his family. Because if it's really ADD, you can see it over generations. of people because it's highly heritable. It's highly genetic. If you don't see it at all in your mom's side or your dad's side, my question is, did you have a fall from a horse when you were 10? And that really triggered off the ADD, because that's clearly a significant possibility.
So what are your top 3 tips for managing ADD if you have it?
Well, getting the proper diagnosis and knowing what type you have. There's 7 different types of ADD. It's not all the same. Not everybody responds to Ritalin or methylphenidate. So know your type. Exercise, so helpful. And then a higher protein, lower simple carbohydrate diet can be helpful, as can fish oil, but not all fish oil. One that's much higher in EPA as opposed to DHA.
Right. Great, thank you. Okay, we're going to move straight to questions. So I got a question from Shane, which is, what are your views of integrative psychotherapy? Where do you stand with this type of work that encourages the lack of framework?
I'm sorry, what kind of psychotherapy?
Integrative.
I'm not quite sure what that means. I'm a huge fan of therapy. I really like cognitive behavioral therapy, and I like EMDR. Those are my 2 favorite kinds of therapy. But I see people always in 4 big circles. We haven't talked about that. Whenever I assess someone, I want to know their biology. And that's where the Bright Minds mnemonic comes in our imaging work. I need to know your brain. That's one circle. The second circle is your psychological circle, or your mind. I need to know how you think. What's your developmental imprinting? And then there's a social circle, which is who do you hang out with, because you become like the people you spend time with. I always tell people the fastest way to get healthy is to find the healthiest person you can stand and then spend as much time around him or her as possible. And then there's a spiritual circle that most psychiatrists would never touch, which irritates me because we're all spiritual beings. And it's what's your deepest sense of meaning and purpose? Do you believe we're just here by random chance to get the most fun out of life we can, or life is meaningless? Or do you have a deep sense of meaning and purpose? Because purposeful people live longer. And understanding the problems in each of those 4 circles and the strategies to optimize them is really important to getting people, to understanding people and getting them well.
Great, thank you. Okay, question from Melissa. For anyone who is dealing with ADHD or ADD, what tools do you recommend for lessening the impact of the symptoms they experience without relying on medication?
So it's, if you don't want to use medicine, and a lot of people don't, you have to get your diet right, increase exercise, and then some supplements like EPA, fish oil, to support your brain. Magnesium can also help calm down the hyperactivity. Zinc can help. Check your ferritin level to make sure it's not too low. The problem is many ADD people, their follow through is terrible. And so without the medication, they don't follow through, and then they're chronically disappointed in themselves. Now, I'm not a fan of drugs and drug abuse at all, but what I learned from my ADD people, that they would often take just a little bit of methamphetamine and their lives would be better. And then they'd marry someone and they'd want to clean up their life, so they stop and their life then fell apart. Now, I'm not recommending people take methamphetamine, but sometimes, especially in our addiction group, that they actually can't stop unless we treat their ADD. So So I'm not opposed to medicine. It's just not the first thing I think of. But if you try and fail and try and fail, then it's an option to consider.
Okay, question from Kim. Have you become involved with any mental health services for the incarcerated? It needs to be a bigger focus with the criminal justice reform efforts.
Oh, so much. I've scanned about 1,000 convicted felons, over 100 murderers, testified in court. Actually had the opportunity to work in a prison system. It was like the month before we had the contract, 9/11, and then it stopped. But I've done a lot of work on convicted felons, and it's fascinating and really important. Dostoevsky said, you can tell about the soul of a society not by how it treats its outstanding citizens, but by how it treats its criminals. I love that. We can do such a better job.
Agreed. Chanel wants to know, do you think consuming dairy can affect your brain, or is this just individual to a person?
Yes, I think it can. Maybe not for everybody, but casein, one of the dairy proteins, mixes in your stomach with hydrochloric acid and turns into casomorphins, which actually work on the heroin centers of your brain. And when I get autistic kids off gluten and dairy, their language often gets significantly better. So I think everybody should try. Avoid gluten, dairy, corn, soy, artificial dyes, and sweeteners. Do it for a month and just see what happens. If you have less pain and less brain fog, then keep it up.
Great. Now, I'm going to wrap up here and save one last question right to the end so people stay listening. So we'll save a best till last. But in the meantime, thank you very much for everyone for attending this week's Work-In with Dr. Arman. Now, as I said at the start, we've been awful at getting people to subscribe to us on YouTube. So please, if you enjoy this, do hit subscribe. We're going to be following up with an email of all the key takeaways from today's session with Daniel landing in your inbox tomorrow afternoon. That email might hit your promotions folder. Do look out for it. Mark it as safe. We'll go from there. Now, next week, on the topic of brain imaging, in fact, we've got Gina Rippon, who is the author of The Gendered Brain and the head of neuroimaging at Aston Brain Center, who will literally be able to talk us through the female brain and the male brain from an imaging perspective. Now, to finish, we want to share a neuroscientific fact that's going to help you remember what you learned today and help us reach more people, which is when you read or watch something, you learn it once, and when you share it, you learn it twice, cementing and building new neural pathways. So please do go on and share on social one thing that you learned today that you didn't know before, and tag at Your Heights and at Doc Arman in the post, and we will retweet and reshare some of our favorite lessons. So to wrap up, Dr. Arman, we've got one question left, which is from Adam, who says, when speaking about maxing out pleasure in our brains, is it possible to undo the effects? I.e., if we stop maxing out, can we reverse those effects?
It's a great question. And the answer is yes. But the sooner you do it, the better. And it really just causes, the way to do it is to engage in brain health and the Bright Minds risk factors that we talked about. So for blood flow, it's exercise. Retirement and aging, it's new learning, and sharing what you have learned. Inflammation, you want to be taking omega-3 fatty acids. Genetics, know your risk factors, and then go after prevention as soon as possible. Avoid head trauma, get rid of toxins. In fact, support the organs of detoxification. I'm a huge fan of infrared saunas, along with fiber, to detoxify your body. Kill the ants, that will help, because stress deadens your pleasure centers. And then colorful fruits and vegetables. There's a linear correlation between the number of fruits and vegetables you eat a day and your level of happiness. And all routines I put together for my patients starts with sleep. Really focus on sleep, because that sets up tomorrow to be better.
Completely agree. I couldn't thank you more for this brilliant and insightful session. Where can people go to follow you on social media, just so they can keep track of your brilliant work?
So Dr. Daniel Amen on Facebook, at Doc Amen on Instagram, And they can learn about our clinics at amenclinics.com, and of course, and get The End of Mental Illness anywhere great books are sold.
Amazing. Thank you so much.